coming up on Healthy Thinking.
If you've ever booked a hotel or a flight online, or maybe you've ordered a food delivery from your weekly shop, then you've almost certainly used an API.
It stands for Application Programming Interface. It's a little bit of code that allows you to speak to some data sets somewhere in your organisation.
It seems like technical jargon, but in truth, we wouldn't be able to live our modern lives without APIs.
Every weather update that you see on a website is an API call. So if you want to see the weather but the API is not working, you've got a website that says today's weather is nothing. An API is obviously necessary to provide the data that you need for the website to work.
But can they help us more? And what can we learn about APIs that will help us improve the way that healthcare is delivered?
We see in the United States that patients can access their own health records, and that's simply because they've standardised the APIs. And once you standardise that, you can really enable new innovation.
I think we need more developers, we need more service people engaged in the development process, and therefore the investment needs to increase, but with that comes huge benefits.
It's just so exciting to step back and reimagine how we can provide health with the digital tools that we now have available, and we just need the ambition to do that.
This is Healthy Thinking from Life Sciences Hub Wales, a podcast series bringing new perspectives from leading thinkers in health and care innovation. It's presented by Carrie-Anne Quinn.
Hello, and welcome to the latest episode of Healthy Thinking. A couple of months ago, I had a fascinating discussion with three people who've been leading the charge on developing APIs here in the UK. I got started by letting them introduce themselves.
Hi, I'm Charlotte Nielsen. I'm a technical specialist from the API software at IBM. So I look after the API use cases that we cover in the whole of the UK.
Hi, I'm Gary Bullock. I'm Director of Application Development Support at the NHS Wales Informatics Service.
Hi, I'm Mark Audle. I'm a consultant neurologist, but I'm also chair of the Welsh Technical Standards Board, setting technical standards in NHS Wales.
Thank you all. Welcome. Croeso. Charlotte, can I start with you? Could you tell us what an API actually is?
So an API, when you're sharing data between systems, for example, with healthcare, you've got the patient's data that's being stored somewhere, probably in any number of systems. An API allows that data to be shared between any other number of systems, which means that useful things can be done with it in the most relevant places in the organisation. So a doctor can look at that data, the family can look at that data, the patient can look at that data, and they can start to do something with that data that might be useful to them. So,
what is that used for?
Yeah, so if I were to give you an example maybe to kind of refer to, you could think of Royal Mail. So each time you track a parcel with Royal Mail, there's some data about where that parcel is, sat somewhere in Royal Mail's systems. And if you're a customer wanting to know where your package is, you can go to the Royal Mail tracking website, right? And you put in your tracking number. And that tracking number is sent via the API to the Royal Mail systems, and it's actually going to send back the data about where that package is, also via that API. So that's kind of how the API would work. If you give it some data, it will give you the useful data back. And then that data can be put onto whatever system you want it to go to.
So given my limited experience and just trying to interpret what you've just said, that data will flow across the internet. So will it flow across the World Wide Web?
It sure will, yeah. So it's going to travel using HTTP, which is obviously an internet protocol. Mm-hmm. Which allows it to travel across the internet quickly and get that data back to you, as soon as your browser can load, essentially.
So how would the internet work for us without an API?
So the internet would still work. The data that you get onto the internet might not be there. So if you can imagine that you've got weather websites, every weather update that you see on a website is an API call to the weather company's data. So if you want to see the weather, but the API is not working, you've got a website that says today's weather is nothing, then there's nothing there. So an API is obviously it's necessary to provide the data that you need for the website to work or the internet to work, yeah.
And obviously the flow of data covers all sectors and all technologies. But for us today, we're really interested to explore how APIs can be helpful in a healthcare setting.